So in 2012, my wife and I were sitting at home. She got a phone call. Her aunt had passed away from cancer. And then a few minutes later, I got a phone call. My cousin had gone into labor 7 weeks premature. Baby needed a heart surgery to live. And same day, same hour, families were hit with these medical emergencies. And I remember one of the big conversations was, how are we going to pay for it? Like, how much is this going to cost? And that was my first run in really with the healthcare system in the US of realizing, oh, you can lose everything because you get sick. You can from no fault of your own be put in a pretty bad situation. So I that frustrated me that, I felt like it should be more around like, how are we going to get well? I realized my family wasn't the only one going through that day. And I think it was just like ignorance of the problem. Like, I was young and I saw that happen. And then I started getting online and looking up medical bills, number one cause of bankruptcy in America. I think at the time, the stats were like 65% of bankruptcies in America are because of medical debt, 78% of those people have insurance. And then the one that really stuck out to me was 85% of the people that declare bankruptcy because of medical bills, it's on bills that are less than $10,000.
Mm.
And that one stuck out to me because I'm thinking, oh, if you're declaring bankruptcy, it's got to be $100,000 bill or something like that. No, there's a lot of people that get hit with a $5,000 medical bill. If you don't have it, you don't have it, and it may as well be $100,000. With that, I thought, okay, what if I started a crowdfunding platform? What if we got a whole bunch of people to give small dollar amounts, and every month we would pool the money together and pay medical bills. So $4 started out as Dollar for Portland because I grew up in Portland, and it was a crowdfunding, grassroots, like hustling in bars and breweries and coffee shops and music venues to get people to sign up for these small donations. And I had that idea in 2012 and started chasing after it. I went to some networking event in Vancouver, Washington, and met this guy named Eli. And Eli was an attorney, and he was really interested in what we were doing. And he asked me if I'd ever heard of charity care, and or he might have said, "Have you ever read Section 501R?" Because Eli's a nerd, and I was like, "No," I was like, "No, I have no idea what you're talking about." So he starts talking to me about this. Oh, hospital. Most hospitals in America are nonprofits, and they have to have these charity care programs that waive medical bills for people within a certain income range. So I'm thinking like, one, how do I not know about this? How does not everybody not know about this? Like, this could change the organization. Like, I felt like an idiot. I had been paying all of these medical bills for these low income families that would have been eligible for free or reduced care if I would have known about these programs. So we started meeting up and digging into these policies and reading hospital charity care policies and started applying for people because it's like we knew all these people with medical debt because they were applying for Dollar for Portland, and it worked. I remember being in my car getting a phone call from this guy that it was like a $6,000 medical bill. He was a super young guy, got in a bad car accident, and he called me and was like, dude, I just got a letter and it says that I have a zero balance. And it was like just this moment of like, holy, I can't believe it worked. Like, I can't believe that it worked. Charity care is a federal law that went into effect with the Affordable Care Act. It requires nonprofit hospitals, which is most in America, to have these policies that will reduce or eliminate medical bills for people if they meet the income guidelines. They don't do a great job of telling people about it, shockingly. We got a lot of people that are on payment plans or declaring bankruptcy for bills that they actually don't have to pay. And that got me real motivated to help more people. It's this huge injustice because it's like we have like these hospitals get to get all the benefits of being a nonprofit, all these tax breaks, sometimes billions of dollars in tax breaks. And the only reason they have that is so that they can provide community benefit, which is charity care, free or reduced care to people within a certain income range. And they don't do that. They're getting all the benefits, yet they're not doing the thing that they're supposed to do. There's been a solution for the last 10 years for a lot of people. A lot of people have declared bankruptcy on bills that they actually never had to pay. We were pretty quick on to let's start applying for charity care and digging. In 7 months, we relieved more medical debt than we had in the previous existence of Dollar 4, and we helped more people. It was so much more impactful. We were able to help so many more people And in that 7 months, we eliminated over $1 million in medical debt for people by just applying and knowing how to work this program and system.